Hey, Dr. Monasebian, I'm thinking about getting jaw surgery. Can you tell me a little bit more about that?
Sure. Well, as many of you know, not only am I trained as a plastic surgeon, but I'm also trained as a maxillofacial surgeon. I went to dental school before medical school, and I do spend a lot of time on the face and particularly the jaws. So what is jaw surgery? Well, I'm not talking just about fixing a broken jaw, but I'm talking about actually resetting the jaws, repositioning the jaws. Now, why do we do this? It could be done for a number of reasons. It could be done for certain birth defects, but most commonly it's done for cases where the teeth on a person aren't coming together that well, and the teeth are so far off because the jaws are so far off, and the orthodontist can't correct the teeth to get in alignment just with braces. So very often we have to do jaw surgery. So if we look at a skull here, we're talking about the upper jaw, which we call the maxilla, and the lower jaw, which we call the mandible. And what we do surgically is make cuts on this jawbone to actually separate it from the rest of the skull, and we can move that jawbone to wherever we want. And the same can be done with the lower jaw. And once these jaws are repositioned, either the upper jaw or the lower jaw, we can either move them forward, backwards, up, or down. We can get the teeth to come into a nice bite, what we call occlusion. And then after that, we have to fixate the bones in their new position. And we use plates and screws, the same plates and screws that plastic surgeons and orthopedic surgeons use to fix fractures. And here you see these little plates that are placed on a jaw that was repositioned. Here it is for the chin, here it is for the jaw, and here it is for the upper jaw. So these plates hold the jaw in its new position. The beauty about this procedure is that it's done once. The effects last a lifetime. All the incisions I place inside the mouth, so there's no visible scarring, and the results are very stable, very accurate. And after the initial healing period, which takes about 4 to 6 weeks for these bones to fully heal, you've got a nice stable bite. And what it will also do is restore the normal proportions and dimensions of your face. So if you have any questions regarding your jaws or your face or your occlusion or anything like that, feel free to visit me here at Park Avenue Plastic Surgery.